She has really good ASIS. So if I put my thumb on her ASIS and I just come down right here, that's going to be the greater trochanter. You don't want to spend a whole lot of time poking around on your patients. It hurts, okay? But, all right, here's the iliac crest. There's AISS, so ASIS. So the greater trochanter is going to be about right there. That's where your axis is going to go. Your stationary is going to go in line with the trunk. The movable is going to follow the femur. Now, we tend to say it's going to follow the thigh, and that's okay. If you say that during testing, I'm probably going to ask you about it because thighs tend to be meaty. In our athletes, they have lots of muscles. In those of us who are not athletes, they have lots of insulation. And so as a result, you have to make sure that you're looking in your mind's eye at the femur and not the bulk of the thigh. In some of our older patients, a lot of times there's kind of some stuff hanging out back behind the thigh, and that'll get your measurement off if you're following that. All right, now there's two ways that we measure this. The first one is we keep this leg perfectly flat, and we have them bring their knee up to their chest. Bring their knee. There you go. And the reason I have her bring her knee is because when I'm measuring range of motion, what am I looking at? I'm looking at the motion of the joint. So the reason she can go further with her knee bent is because of muscle tightness, hamstrings, okay? Not the reason she can't go further when her leg is straight. So what I'm looking at is the joint, right? So I'm looking at, can you come up any further? Okay. All right, so with that, I got 110 degrees. Normal is 100 to 120, so stay right there for me. Now what I'm going to allow her to do, bend that knee for me just a little bit. Pull that knee in further. Okay. And I'm going to check it again. And that time I got 115. Bring your leg down. Why did I do that?
Pelvis anterior. Does it come forward your pelvis whenever she lifts her other leg?
When she's lifting her leg up, the pelvis anteriorly tilts. When I keep this leg flat on the ground, it doesn't allow the pelvis to tilt. So by first of all checking with, and you'll see most people do it with the legs straight, but I can allow her to bend this knee just a little bit, not a whole lot. I don't want her rocking up off of her back, but by letting her bend this knee just a little bit, it allows the pelvis to anteriorly tilt and gives me a better idea of what the range of the actual joint is. You may have to change your measurements because in some people they'll actually tilt slightly, so you may have to adjust your stationary arm just a little bit. Good? All right, so for with your infield, you're looking at a soft, firm tension at the end. It doesn't really have a hard infield. The belly can get in the way, particularly for our gushy patients. So if they only have 90 degrees of flexion because of a belly that's in the way, then that's something that you document. It's pretty much everything.